A previous Mpox patient has recounted his terrifying ordeal with the illness as worries increase regarding a new, possibly more lethal variant that is very likely already present in the UK. The clade 1b strain, first identified in the Democratic Republic of the Congo, DRC, has been confirmed in Sweden and Pakistan. This variant is considered to be the most perilous to date, prompting the World Health Organization, WHO, to label the outbreak a global health emergency. The disease has proliferated to 13 African nations, with over 15,600 cases and 537 fatalities reported. Professor Paul Hunter, an expert in infectious diseases, informed Sky News that it is very likely this new variant has already arrived in the UK, although definitive confirmation may take weeks. He clarified that it usually takes several days for the illness to present in a way that is recognizable as Mpox, and an even longer duration for samples to be tested and sequenced to determine the specific strain. When an individual acquires an infection, they typically take several days before exhibiting the classic signs that might lead people to think, "Oh, this is Mpox," Professor Hunter stated. He pointed out that the illness starts with non-specific symptoms that can easily be confused with flu or COVID-19, followed by the appearance of blisters. Mpox, formerly known as monkeypox, is mainly transmitted through the fluid from blisters, often during sexual intercourse. The illness results in painful blisters on the face and other areas of the body. Even though this marks the second time in 3 years that Mpox has been designated an emergency, Professor Hunter reassured that for most individuals, the disease is relatively mild and they can recover independently. Nevertheless, he warned that the risk of infection is heightened for those participating in certain sexual networks with multiple partners. Horrendous, who became infected with Mpox during the 2022 outbreak, described his ordeal as frightening. His symptoms began with flu-like indications, such as a high fever and muscle pains, before painful lesions and scars emerged on his skin and in his throat. He struggled to be taken seriously by medical professionals who were not well informed about the virus at that time. "It was truly terrifying," Touloune remarked, recalling how his early requests for an ambulance were turned down, and he was misdiagnosed 4 times. "After 2 weeks of excruciating high fever and pain, I was unable to move, drink, or eat anymore. At that stage, I was admitted to the hospital," he shared. Even upon arriving at the hospital, it took 3 days to get the correct diagnosis. Touloune spent 11 days in the hospital before he began to feel better. He then quarantined at home for an additional 2 weeks until all his scars healed and he was completely restored. His story highlights the difficulties of accurately diagnosing and treating Mpox, especially in light of emerging, more hazardous variants. If you found this video insightful, please like, comment, and share your thoughts below.